Welcome. I am so glad that you're here. Today, we're talking about something that affects nearly every system in the body, but it's still widely misunderstood: hormones. This presentation is called The Hormone Connection: Why You Feel Off and How to Fix It. If you've been curious about how hormone changes may be affecting you, if you've ever had difficulty losing weight or just felt tired, foggy, moody, just not like yourself, just to be told that everything is normal, this conversation is for you. My name's Tina Jacobs. I'm a physician associate and owner and founder of Silk Life Medical, and I specialize in hormone balance. I trained in Miami, one of the most advanced hormone therapy hubs in the country, and for over a decade, I've worked with patients who knew something wasn't right, but couldn't find real answers in traditional medicine. Silk Life exists because I couldn't find the answers in the kind of care that I really needed when I was struggling, so I built it. I started Silk Life after my own journey and experience with traditional medicine. I was gaining weight, over 60 pounds, despite a healthy life, and I was exhausted. I knew something had changed in my body, so I went to my doctor. They ran some basic labs just to come back and tell me everything's normal. All you have to do is just eat less and exercise more. Or, of course, you're exhausted. You're a busy woman. I left thinking, what is wrong with me? Why can't I just get it together? I felt so much shame. Now, I was overweight, exhausted, and demoralized. And I struggled with this for years before I figured out what was really going on: a hormone imbalance. My goal now is to reach all of those men and women who know something has changed in their body and they're feeling dismissed. I want to help them to identify what's going on so we can put all the options on the table and fix it for good. And that's why this presentation isn't really all about me. This conversation is for people who know something doesn't feel quite right. They're paying attention to their health and they just want clear answers. If you're here, you're already taking the next right step. Today, we'll cover what hormones actually do, why imbalances are often missed, what hormone optimization really means, and what care at Silk Life Medical looks like. So let's dive in to Hormones 101. Now, hormones are chemical messengers. They tell the body what to do and when to do it. When they're balanced, things feel more effortless. When they're not, everything can feel harder. Hormones regulate nearly everything: your metabolism, your mood, your sleep, your heart rate, your appetite, your sexual function, your ability to focus, and even how your body handles stress. So when one system is off, it's rarely isolated. When hormones are imbalanced, you can experience a wide range of symptoms, but some of the most common ones that bring people to my office because they're really bothersome are low energy and motivation, brain fog or trouble focusing, mood changes or irritability, low libido or loss of enjoyment with sex, weight gain or muscle loss, or poor sleep. These symptoms are not random. They're signals from your body that something has changed. So why doesn't my primary care physician just give me hormones? That's one of the most common questions I hear. For people, it's not that their primary care doesn't care about them. It's that the system they're working with wasn't built for hormone optimization. Hormones aren't a major focus in traditional medical training, especially when it comes to how they shift with age or how symptoms show up, even when labs can look normal. On top of that, there was a lot of misinformation in the 2000s that created long-lasting fear around hormone therapy. Even though the science has evolved and those concerns are still influencing practice today. And finally, primary care operates under insurance-driven guidelines. Those guidelines are based on broad population averages, so if your numbers fall within range and are normal for your age, the system considers you a success, even if you still feel exhausted, foggy, or off in some other way. So patients are left thinking, well, if my labs are normal, why don't I feel normal. At Silk Life, we don't stop at normal. We ask you whether hormone levels are actually supporting how you want to feel and function. And that's where the difference it becomes really important between normal and optimal. Unfortunately, most doctors still focus on just getting your levels into that wide normal range without considering what is optimal for your body. Here's the key distinction. Normal means you fall somewhere within that statistical range. It doesn't mean your body is actually functioning optimally. For example, let's take vitamin D, which is structurally a hormone. It's considered normal at 30. Now, because it's in that wide range of anywhere between 30 all the way to 105. That's a huge range. And the science and research really shows that especially as we age, having levels at 60 to 105 really has a dramatic impact on supporting the body, preventing disease, and even optimizing mood. So why would we settle for just barely making normal when optimal is such an easy option? Additionally, optimal isn't just about hitting a specific number, even in that optimal range. It's where your body specifically operates at its best. At Silk Life, we're not chasing those specific numbers. We treat the real patient. So which hormones are likely to cause the symptoms that we're talking about? First, in men, naturally, testosterone is higher than many of the other hormones in a male body. So when testosterone starts to change, that's where men will notice it the most or notice it first. When testosterone drops, the main things men will notice is persistent fatigue or loss of motivation, difficulty putting on muscle or burning fat, causing weight gain, but brain fog, irritability, and men can experience low libido or changes in sexual function. But do not wait for low libido or changes in sexual function to get your testosterone tested, because this is usually the last to go. When testosterone is optimized, men see that consistent energy and motivation again. They see improved body composition naturally. They see restored muscle and strength and restored clarity and focus and greater physical resilience. Now let's over to women. Women's hormones are slightly more complex, but the main ones we'll notice changing after age 35 are the ovarian hormones, testosterone, estrogen, and progesterone. Yes, women need a little bit of testosterone too for that optimal energy, metabolism, and brain function like we talked about with men. But declines or imbalances in any of these hormones can show up as poor sleep, anxiety, fatigue, weight changes, brain fog, low libido. They can also cause symptoms like longer periods, hot flashes, night sweats, or headaches. There's over 100 symptoms that can be associated with the decline in ovarian function, but those are the most common ones women will report. When these hormones are balanced thoughtfully and monitored carefully, women see their symptoms resolve and their well-being restored. They report stable energy, improved sleep, restored mental clarity and mood balance, and just better stress tolerance. Most importantly, men and women get back to feeling like themselves again when hormone balance is restored. In detailed labs, we'll look at a wide range of hormones and how, because they all work together. Thyroid hormones, adrenal hormones, and pancreatic hormones are all important to men and women too, just in different ways. It's okay if you're skeptical. A lot of people come in with concerns shaped by outdated or incomplete information, so let's clear that up. You may have heard hormones cause cancer, or hormones cause heart problems, hormones cause blood clots. These fears didn't come from nowhere, but they're just not supported by well-designed modern research. You're not doing yourself any favors by avoiding hormones when your body needs it. The fact is that hormones are safe, but they're vital to living a long, healthy life. The science shows that maintaining optimal hormone levels not only relieves all these symptoms we talked about, but also reduces age-related risks, such as dementia, Alzheimer's, osteoporosis, metabolic syndrome, even diabetes. When hormones are optimized, the patients report feeling happier, feeling stronger, feeling sexier, and younger. And who doesn't want to feel all of that? Why just stop at normal when optimal is possible? When we talk about hormone optimization, this isn't just about how you feel day to day, although that's really important. Hormones play a major role in how the body ages. When hormone levels are low or imbalanced, we see changes in insulin sensitivity, visceral fat, lipid patterns, mood regulation, cognitive function, and sexual health. Over time, those shifts can increase the risk of many age-related concerns listed here. When hormones are appropriately supported and monitored, the body tends to just function more efficiently. Metabolism improves, energy becomes more stable, muscle mass is easier to maintain, mental clarity improves, and people are better able to respond to stress physically and emotionally. So obviously that's going to impact so many areas of the body. It's not just about preventing disease or making any guarantees. It's just about reducing strain on the body and improving how all these systems work together over time. That's really what we mean when we talk about health and longevity. The bottom line is that optimizing your hormones with bioidentical hormone replacement therapy is exceptionally safe and effective, and it reduces long-term risks related to aging. There is a night and day difference between optimized hormone levels and just normalized. Optimization requires treating the real person, not the numbers, and customizing treatment to what your body really needs. There is no one-size-fits-all plan when it comes to hormone optimization. At Silk Life, labs guide us, but your symptoms, your intuition, and your experience is what leads us. You know your body better than anybody else. What about thyroid? We didn't get deep into that earlier, so thyroid is often misunderstood. Most commonly at your primary care provider, they're going to test a TSH level, which is just one single test. And as long as that level is within that wide normal range again, your thyroid's normal. Even if you're having all the symptoms of low thyroid function and are at the lowest end of normal, you're fine. No further workup needs to be done. But the studies have shown that for women or men who will eventually develop hypothyroid, they typically suffer with symptoms for 8 years before TSH actually diagnoses them as hypothyroid. That's way too long for people to be suffering before getting treatment. That's why a deeper thyroid panel is so essential. At Silk Life, we evaluate that full thyroid panel, including your active thyroid hormone, that free T3. This level gets frequently overlooked at primary care. And these tests give us the full picture when we combine them with your personal experience. Once again, the numbers matter and your symptoms and experience, your intuition also matters. Thyroid hormone determines how quickly you metabolize each calorie to use it for energy. So as you can imagine, low thyroid function can cause a wide range of symptoms, but the most predominant symptoms are going to be fatigue and weight gain. Other clues might be that you have constipation, cold intolerance, hair thinning, brittle nails, brain fog or memory issues. Again, all these symptoms matter. Even after hormones are optimized, your care doesn't stop. As time goes on, your hormonal needs will change, and it's important to have someone in your corner that you really trust so that we can adjust and make sure your health stays on track and you stay living that optimal life. Every person is different when it comes to their hormone needs, and it really changes over time. Be careful to avoid practices that offer a one-size-fits-all approach with minimal follow-up. At Silk Life, we monitor, we adjust, and we stay with you. Now, hormones are the most important, essential first step to an optimal life. At Silk Life, we specialize in offering all of the most cutting-edge therapies, including those hormones, but also advanced peptide therapies, medical weight loss therapies, and vitamin therapies that also can play a huge role in optimizing your life. Hopefully you got all of your key questions answered. If not, we're here to answer your questions at Silk Life. But if you're ready to move forward, let's talk about what would be next. Before your first appointment at Silk Life, we recommend detailed labs and detailed paperwork. When combining the numbers with your symptoms and your history, we'll be able to dive deep into what's really going on in your body and what we can really do to help. Labs can be drawn at Silk Life Medical in Lakewood, Colorado, or at a blood draw site near you. Then your first visit is where everything starts to come together. We don't just look at your labs and tell you what's normal and what's not. We review them in the context of your symptoms, your history, and what you're actually experiencing day to day. We take the time to explain what each lab test actually means for you and why it matters or doesn't. We look for patterns, not isolated numbers. Then we connect the dots to identify exactly why you're feeling the way you are and put everything on the table, what the options are to fix it. From there, we create a personalized plan together, not a one-size-fits-all template or protocol, but a plan designed around your specific biology and your specific goals. Before you leave, you know exactly what the next steps are, what to expect, and how we'll continue to adjust your care as your body responds. The goal of this visit is clarity, as well as hope and excitement for what's possible with your treatment. So what can you expect from the Silk Life Medical team? This is concierge level medical care. Care that is customized to you and your body. Care that really listens to understand. Care that takes the time to explain. Care that empathizes because we've been there ourselves. And care that is always on your side. Our goal is to help you understand exactly what your body is telling you so you can feel like yourself again. Thank you so much for trusting us with your time today. If you have questions, we're ready to help.